Trichomoniasis is a common STD and it affects both men and women, although it's most common in women. It's the most curable STD in young sexual active women. It's estimated around 7.4 million new cases every year pop up in men and women. Trichomoniasis is caused by a parasite. In women, the vagina is the most common site of infection. And for men, the most common site for infection is the urethra, which is the urine canal. The parasite is sexually transmitted through penis to vagina intercourse or vulva to vulva, the contact with the infected person. Women can get the disease from infected men or women, but men usually contract it from an infected woman. Most men who have trichomoniasis do not have any symptoms. Some might have a irritation inside the penis, a little bit of a discharge or a slight burn after urination or ejaculation. Some women do have signs or symptoms of the infection, as in a yellow-green vaginal discharge with a strong smell. It can also cause discomfort during intercourse and urination, as well as irritation and itching of the female genital area. Sometimes, in rare cases, the lower abdominal pain can occur. Symptoms usually appear in women within 5 to 28 days of exposure to the parasite. Genital inflammation caused by trichomoniasis is increased in women who susceptibility to HIV infection. If she is exposed to the virus, having trichomoniasis may increase the chance of an HIV infected woman passing HIV to her sexual partner. If you are pregnant and you have this STD, then you might have a baby who is born earlier with a very low birth weight, which means less than 5.5 pounds. For men and women, a doctor would perform a physical examination and lab tests to diagnose if it is trichomoniasis. In men, it's harder to detect the parasite than it is in women. In women, a pelvic exam can show a small red um, ulcers or sores on the vaginal wall or the cervix. Trichomoniasis can usually be cured with a prescribed drug given by mouth in a single dose. Symptoms of the STD in men can disappear within a few weeks without treatment. But if an affected man, even a man who never has symptoms or whose symptoms have stopped, can continue to infect or reinfect a female partner until he has been treated. So if you're in a relationship, both of the partners should be treated at the same time to eliminate the parasite. If you're being treated for trichomoniasis, you should avoid sex until you and your sex partners have finished your treatment and have no more symptoms. Metronidazole can be used by pregnant women. If you have trichomonas once, it does not protect you again from not getting it. Following the treatment, people can still get the infection again. The best way to avoid from getting a STD is to abstain from any sexual contact or to be in a mutual monogamous relationship with one partner who has been tested and is known to not have any infections. Latex male condoms can be used right and reduce the risk of the transmission. If there's any genital symptoms such as discharge or burning during the urination, or a sore or a rash, you should stop having sex and you should go to your doctor immediately. A person who is diagnosed with trichomoniasis or any other STD should go and get treatment and let all of their recent sex partners know that they have been treated so that they can go to the doctor and get treated themselves. This reduces the risk that the sex partners can develop complications from trichomoniasis, and it reduces the risk that the person with the STD will become reinfected. You should abstain from sex until the person with the STD and all of their recent partners finish their treatment and have no more symptoms.